This is the extensor retinaculum of the ankle joint. It is 2 in number. This one is superior extensor retinaculum and this one is inferior extensor retinaculum. Superior extensor retinaculum medially attached to the lower part of the anterior border of tibia and laterally attached to the lower part of the anterior border of fibula. And inferior extensor retinaculum, it is Y-shaped and this is a stem of Y which is attached to the lateral surface of calcaneum as well as the talocalcaneum ligament, and this one is proximal limb and this one is the distal limb. Proximal limb is attached to the anterior margin of the medial malleolus and distal limb is going downward, going backward and intermingle with the fibers of plantar epineurosis. The structure passing beneath the superior extensor retinaculum from medial to lateral, it is in the Himalayas are not dry places, that is tibialis anterior, extensor hallucis longus, then artery, anterior tibial artery, deep peroneal nerve, and then dry places, that is the extensor deuterum longus and then peroneus tertius. And here we can see the stem of Y of inferior extensor retinaculum. It is bilaminar, 2 layer, and which give passage to the lateral four muscles, that is the peroneus tertius and extensor deuterum longus. Whereas the proximal limb of the inferior extensor retinaculum, it is also bilaminar. This is inferior lamina and this is superior lamina, and in between these two the tibialis anterior and the extensor hallucis longus passes. Okay, and the distal limb, it is only 1 layer and beneath which all the structure passes. Okay, and it is the superior extensor retinaculum, it is also of 1 layer and beneath which all structure passes, and we all know the arrangement of structures. Regarding its clinical significance, sometimes the deep peroneal nerve get compressed by the extensor retinaculum and then it will result into the foot drop, that the action of all these muscles, the anterior compartment of leg muscles are dorsiflexion, that dorsiflexion, so it will get paralyzed and it will result into foot drop. That person cannot dorsiflex the foot.